Today, let us discuss about peptic ulcers. Formation of sores in the lining of the stomach or duodenum is referred to as peptic ulcer. Disruption of the mucosal lining by the action of the gastric acid and pepsin is the main reason of formation of ulcers. Peptic ulcer in the stomach is known as gastric ulcer. Peptic ulcer that develops in the first part of the small intestine is known as duodenal ulcer. The main cause of ulcers are due to H. pylori. H. pylori is a gram-negative bacteria which commonly lives in the mucosal layer that covers and protects the tissue that line the stomach and small intestine. It generally doesn't cause any problem, but it causes inflammation of the stomach inner layer producing an ulcer. It may be transmitted from person to person by close contact. The infection is transmitted through fecal oral route. Acids used for prolonged period of time alter the balance of mucosal barrier because they prevent the synthesis of the prostaglandins which are responsible for maintaining the mucosal barriers. Some of the NSAIDs include ibuprofen, naproxen sodium, ketoprofen and others. Acetaminophen is not an NSAID and won't cause damage to the stomach. Other medications along with NSAIDs also increase the ulcer formation. Other medications include steroids, anticoagulants, low-dose aspirin, selective serotonin reuptake inhibitors, alendronate, risendronate can increase the chance of developing the ulcers. Excessive secretion of gastric acid in Zollinger-Ellison syndrome, which is characterized by the presence of gastrin-producing tumor, causes excessive gastric acid secretion and ultimately results in peptic ulcers. Stressful conditions may increase the GI bleeding. Some of the stressful conditions include sepsis, severe trauma, acute renal failure, and injury. Risk factors. Smoking may increase the risk of peptic ulcers in people who are infected with H. pylori. Alcohol can irritate the mucous lining of the stomach. It increases the amount of stomach acids. Spicy food, coffee, milk are the main reasons of ulcer formation because these foods increase the gastric acid secretion in the stomach. Some of the symptoms: burning stomach pain, feeling of fullness, bloating, belching, intolerance to fatty food, heartburn, and nausea. It may lead to severe symptoms like vomiting, blood in the vomiting, dark blood in the stools, trouble breathing, feeling faint, nausea or vomiting, unexplained weight loss, appetite changes. Diagnosis: common used test for H. pylori induced peptic ulcers. Serologically antibody test. This test is used to detect the IgG antibodies. In case of H. pylori induced peptic ulcers, there is an increased level of IgG antibodies. These increased level are assessed by the ELISA test. Stool antigen test. Antigens responsible for H. pylori are detected in urea breath test. Urea breath test is said to be most accurate. The patient is supposed to take urea labeled with radioactive carbon. In patients infected with H. pylori, urease enzyme hydrolyzes the ingested urea to ammonia and radio-labeled bicarbonate. This radio-labeled bicarbonate is absorbed into the blood and excreted by the lungs as labeled carbon dioxide. Patient air is blown into the bag and then sealed. Persons infected with H. pylori breath sample will contain the radioactive carbon in the form of carbon dioxide. Endoscopy. In endoscopy, a lighted tube with a camera at the end is passed down from mouth into the stomach and duodenum in order to Visualize the lining of the stomach tissue and duodenal tissue in order to identify whether there is an inflammation or not. In case if ulcer is detected, a small tissue sample is removed for examination in the lab. This biopsy is used to identify whether H. pylori is in stomach lining or not. In upper gastrointestinal series, radiography is preferred. The patient is supposed to drink a liquid like barium, then X-ray is taken. If any abnormalities are present, they can be detected by the X-rays. Medication. In H. pylori induced peptic ulcers, antibiotics are used. These antibiotics kill the gram-negative bacteria. Some of the antibiotics used are amoxicillin, clarithromycin, metronidazole, tinidazole, tetracyclines, levofloxacin. These antibiotics are used in combination with proton pump inhibitors or H2 blockers in order to prevent the excessive acid secretion. Proton pump inhibitors. They irreversibly bind and inhibit the hydrogen potassium ATPase pump, which is involved in the acid secretion, thereby decreasing the acid secretion, promote healing. Some of the examples of omeprazole are omeprazole, lansoprazole, rabiprazole, esomeprazole, pantoprazole. Histamine antagonists. These drugs act by blocking H2 receptors in the parietal cells of the stomach. This relieves the ulcer pain and promotes healing. Some of the examples are famotidine, cimetidine, nijatidine. Antacids neutralize the existing stomach acid and provide rapid pain relief. Side effects include constipation, diarrhea, depending upon the main ingredients. Some of the examples of the antacids are aluminum antacid, calcium carbonate antacid, magnesium oxide antacids. These relieve the symptomatic pain. Cytoprotective agents. These are the agents which protect the lining of the stomach and small intestine, protecting the cells in the GI tract from damage caused by the agents such as gastric acid, bile salts, alcohol, and aspirin, and among other substances. Most commonly used cytoprotective agent is sucralfate. Dosage regimens for 14 days are generally prescribed for healing. Two-drug regimen. In two-drug regimen, an antibiotic or proton pump inhibitor or histamine blocker are used. For example, omeprazole 40 mg OD or 20 mg 2 times plus clarithromycin 500 mg TID, or omeprazole 40 mg OD or 20 mg BID plus amoxicillin 500 mg QID. In three-drug regimen, two antibiotics are used along with proton pump inhibitor or H2 receptor. These regimens generally contain a single antibiotic or two antibiotics along with proton pump inhibitors or H2 receptor antagonists. Based upon the patient condition, regimen is prepared. If peptic ulcers are left untreated, it may develop internal bleeding. Bleeding in small proportions lead to anemia. Bleeding in large proportions lead to hospitalization or blood transfusion. In some cases, blood loss may cause black or bloody vomiting or black stools. A perforation in the stomach wall. Obstruction. Peptic ulcers can block passage of food through the digestive tract, causing to vomit or to lose weight, either through swelling from inflammation. Gastric cancers. People infected with H. pylori has an increased risk of developing gastric cancer. Prevention. Avoid smoking, avoid alcohol, use caution with NSAIDs. Don't ignore ulcer symptoms. Protect from infections by washing hands regularly and consuming the food that have been cooked thoroughly.